Now let him get answered.
Representatives of 5 unions representing health workers will on Monday congregate with a common agenda, vowing to down their tools by 18th of May if the government fails to fully address their grievances within 14 days.
Mgomo upo, utaanza tarehe 18 ikiwa kama yale ambao tumesema hayatatekelezwa.
In the wake of COVID-19 pandemic, the health workers are accusing the government of failing to address their concerns, which include providing risk allowances as well as harmonizing of allowances despite their continuous pleas.
Currently, some health workers enjoy a risk allowance ranging from 3,000 lowest to 20,000 highest. Hence, we request for harmonization of the same allowance to Kenya shilling 30,000 across all the health cadres.
To ensure fair labor practices, to ensure fair remuneration, to ensure reasonable working conditions.
So tumesema kwamba lazima tuhusishwe, na pia wakati ambapo wanaenda kutengeneza ile welfare ya wafanyakazi, lazima sisi tukue consulted.
The unions are also seeking promotion of health workers, conversion and confirming to permanent and pensionable, and the formulation of frontline health workers welfare package.
That healthcare workers have stagnated in entry job group for over 8 years, both in the Ministry of Health and the counties. This is despite continuous signed agreement between the employers and the union, which later they are turned away, never to be implemented.
The union's representatives accusing dark forces within the health ministry for the sad state of affairs.
How can you transfer, redeploy people? You are saying they have misappropriated funds. They are supposed to remain in the ministry, investigate them. If they are found guilty, let them face the full force of the law. And then in Afi House, someone is taking tea worth 89,000 per day. Kwani hii chai inatoka mbinguni na chartered flight? What type of tea is this?
Comes as the government says they're working on a plan to address the grievances.
Discussions with them, and you remember His Excellency the President pronounced himself on the welfare of healthcare workers, and the ministry has worked very closely with the Public Service Commission, Salaries and Remuneration Commission, and we have developed a plan which is awaiting approval before it can officially be shared with the healthcare workers.
We highly recognize in the Ministry of Health that we have 17 cadres, and all these cadres all come together magically to take care of us. And so there's no favoritism for any one specific cadre, and all cadres who are working as a team will be able to be facilitated with a welfare package.
Who they say are deliberately derailing ongoing efforts to selfish interests. Upon the lapse of the 14 days ultimatum issued by representatives from the Health Workers Union, Kenya will become the second country in Africa to go on a strike during the COVID-19 outbreak due to poor working conditions, among other grievances, after Zimbabwe, who downed their tools mid-March due to lack of PPEs. Reporting for Channel 1 News, I'm Sarafina Robbie.